Hi, my name is Betsaida Fernandez, and I'm a Purdue University Northwest nursing student. And today I'll be showing you all how to irrigate a wound and change a wound dressing. So for this procedure, the first thing I would do is review the patient's health record and the procedures that I need to take to perform wound care. So my first task would be to perform hand hygiene. And get that in there, and put on any personal protective equipment as per the health record states. So after doing so, I go into my patient's room. My patient's name is Theodore Bear. So, hi, Mr. Bear. How are you doing today? My name is Betsaida, and I'll be your nursing student. So, first thing I want to do is check your ID band and make sure that I have all the correct information. Okay. So, if you could just give me your ID band. Okay, Theodore Bear, date of birth. Looks all correct here. Alright. I have already previously gathered all of my materials and laid them out on a clean surface that I see all fit in the bedroom, or in the clinic room. And so, Mr. Theodore, do you have any pain right now that that you'd like to let me know of? No pain? Good. So today I will be irrigating your wound as well as changing your dressing. Is that okay? Okay, awesome. So I have already got all my things. If he said that he had some pain, I would administer any medication to and then give it some time to work before I start the procedure. And now that I'm ready to start, I have all my things laid out on a clean surface. I'm going to put a towel underneath him. Mr. Theodore, I'm going to expose your leg just a little bit. Okay. I would as well put him in a comfortable position, and put the bed into a comfortable working position, and make sure that he is comfortable during the entire procedure. I already have my trash can here, and I will be putting my irrigation tray underneath the wound shortly. So, my first task here would be to remove the wound dressing that is already there. So I'm going to use the push-pull method and remove it so that I do not harm the patient. Okay. Noting on the dressing the amount of drainage or discharge, the color, and the smell. So I don't have much here. All I see is the redness from the blood of the wound, and just a bit of darkish drainage from what it appears to be necrosis of the skin tissue right here. So as I examine the wound, I see that the surrounding of the wound has necrotic tissue, and the inside appears to be beefy red. And I would document that as well as measure it. So I have my measuring stick here. I'll measure in centimeters. I have a 6 centimeter in length wound, 2 centimeter width, and I will also measure the depth. Okay. We have 1 centimeter in depth. And I would also document that down in his chart. Okay, now that we have that there, I'm going to remove my gloves and perform perform hand hygiene and commence my sterile field. So I will perform hand hygiene. Okay, hands are clean. First thing I want to get is my polyline drape. Okay, I did note that the package is not expired, opened, or damaged. Okay, I'm only touching the outsides and nothing else. I'll lay out the drape in front of me on this clean surface. Okay, now that that's there, I also have my gauze, not expired, opened, or damaged. I will open that right over my field, ensuring that I touch nothing else. Okay. We'll also use this for the saline solution. As well as my irrigation tray, not expired, damaged, or opened. And we'll open it up in my sterile field. Just drop like so. I will as well put this underneath the wound. Alright, let me put this underneath your leg, Mr. Bear. Okay, is that comfortable? Good, good. Okay, now that I have that there, I'll also open my swabs right onto our sterile field. Okay. And just pop them right over. Okay. There's that. As well as the abdominal pad. It's also not expired, opened, or damaged. Okay. Got that there. Now as I'm doing this, I might as well get the saline solution, pour a bit into my gauze tray so that I can later drench my gauze. Also, put a bit of lubricating jelly on my sterile field so that I can then lubricate the wound. Okay. Now, on this separate, let's not forget to set aside our pieces of tape for the abdominal pad. Also, noting that you're not touching the sterile field. On the separate clean surface, I will get my sterile gloves. It is not open, expired, or damaged. Okay. Okay, only touching the outer portions of the packaging. I'll put it on the flat surface. Open the top flat, the bottom flat, the middle folds, I will pull them outward. Okay, now only touching the inner portion of the cuff, I will glove my dominant hand. Okay. With my sterile glove, I will grab the outer portion of the glove, opposite glove, and glove my non-dominant hand. Okay. And then I will fix as needed. Okay. Now that we have our sterile gloves on, we're ready to start irrigating. So I will grab my syringe. Okay. with some of the saline solution. Okay. We'll go over to Mr. Bear over here. I will, with my now will be clean glove, I will grab the irrigation tray. This is now my sterile hand, and I will irrigate the wound until the water becomes clear. Okay. Okay, now that it has been cleared, I will remove the irrigation tray. Put this back on my sterile field away from my other items. This is my clean hand, therefore I will set this aside in a different location. Okay, with my sterile hand, I will put, I will grab some gauze just to dry him up a bit. Okay. Do not want to dry the inside, only the outer areas. This is now trash. Okay. And with my swab, I'll collect the jelly that I have put on the sterile field and lubricate the outer portions. Okay. Still feeling well, Mr. Bear? All right. Sounds good. Okay. Now that we're done with that, I will get some gauze and I will moisten them, I'll drench them in my saline solution. I'm also noting that it's still with my sterile hand. Also with my sterile hand, I will grab my swab, put it in my clean hand in order to pack. My sterile hand, grab the wet gauze. Okay. Hold it like so. And we will pack this into his wound. Okay. I would pack it evenly, making sure that all portions of the inside of the wound are packed with this gauze. Okay. Now this is trash. Okay. I will also try to dry him up a bit around the outer portions, just in case a little more water had come over. Now that we have that done, I will now finally cover his wound with gauze. And still noting, at this moment, our sterile technique is no longer needed, therefore I can grab my abdominal pad and use both hands to secure it. With our tape. How does that feel, Mr. Bear? Good? Now that our wound is covered with the abdominal pad, we are free to cover him right back up. First, I want to remove my gloves. Discard. And once discarded, I could definitely cover him right back up. After writing my initials, dating, and putting the time on the wound covering. Okay. All comfortable? We would return him back to a comfortable position, making sure we don't leave any wet items around him. Okay, once he's all comfortable, thank you, Mr. Theodore Bear. It was a pleasure taking care of your wound today, and I hope you'd let me take care of you again. So now I grab all my materials. I've already removed my gloves and I could perform hand hygiene. You just want to make sure that you do come back into the room and check on the wound at least every shift. And that is all. Thank you.